I'm Mayor Todd Gloria. Thank you all so much for being here today for an important announcement. I'm pleased to be joined by our County Board of Supervisors Chairman Nathan Fletcher, County Public Health Officer Dr. Wilma Wooten, City Council President Dr. Jennifer Campbell, and Councilmember Chris Cate, along with some other local leaders who are helping us to make this announcement this morning. The building that you see behind me is more than just a senior center. Starting next week, the Kathy Hopper Claremont Friendship Center will become a temporary monoclonal antibody regional center. That's a mouthful, so you can just call it MARC for short. Now, many of you would likely ask, what is a MARC? Let me explain. In short, this is a center that will save lives. It will provide early treatment to COVID-19 positive patients, helping to prevent hospitalization, but that's not all. The MARC site will be the first in this county to provide free on-site COVID-19 testing and post-exposure prophylaxis alongside treatment for anyone who is medically eligible, regardless of immigration status or health insurance. I'm proud of our city for making this possible by providing this city-owned facility at no cost for this purpose. Shout out to Penny Moss, the Director of Real Estate and Airport Management, new title, at the city for working swiftly to make this possible. The availability of both testing and treatment in the same facility provides a unique and much needed opportunity to ensure that anyone who tests positive for COVID-19 has immediate access to treatment. This will ease the burden on local hospitals and help prevent the spread of COVID-19 in our city, especially in light of the highly contagious Delta variant. I'm very proud of the collaboration and partnership that has made this possible. And in particular, I want to thank Chair Fletcher and the County of San Diego for developing this model for the MARC sites, connecting patients to care and establishing sites just like this one throughout the county. I also want to thank our partners at the state of California, in particular Governor Gavin Newsom and the members of the legislature who are providing clinical staff as well as supplies needed to ensure that no-cost testing and treatment is available to all eligible Californians. And so thank you so much, members of the media, for being here today to help us spread the word to San Diegans who may be able to benefit from this important site. With that said, I'd like to welcome County Board of Supervisors Chairman Nathan Fletcher to give you some more information. Mr. Chairman.
Thank you, Mayor, and good morning. This is another step forward in our efforts as a region to try and beat back, confront, and protect the public from COVID-19. And I want to thank the Mayor, who is here. I want to thank the members of the City Council. I want to thank all the medical folks who are here, who for the last year and a half have got up every single day and looked for every possible way we can save lives and protect our community, protect our economy. This morning I dropped off my kids for their first day at school. Everything we're doing here is designed to give us as much of our life back, keeping our kids in school, keeping our economy going, and saving lives, fighting to save lives and protect our communities. And so I appreciate everyone who is here today. This is another part of our efforts to protect the integrity of our healthcare system, to share resources that are out there and available, and continue to drive forward collaboratively working together. We're here today to reinforce this effort, adding another monoclonal antibody regional center to our region's portfolio. As the Mayor mentioned, these monoclonal antibodies are another great example of ways that science and medicine can help protect us. And we have to trust and believe and know that these efforts work. We're standing here today surrounded by doctors, Dr. Wooten, Dr. Tudor, Dr. McDonald, so many others who are here today who have taken an oath to save lives. And these antibody treatments are another thing that by trusting the medical community, by trusting your doctor, it's something that can help save lives. It can help people with mild to moderate cases of COVID who are at risk of moving to a more severe form of COVID. And the treatment can kick in very rapidly. This center and the work that's been done here and the teams of doctors and nurses who will administer these are helping, again, build our capacity. Today is also another example of our city and our county working together, collaboratively. When Mayor Gloria got into office, I knew the city-county relationship would be stronger than ever, not just in our communication and our work together, but in the substantive steps we're taking, whether it be working together around housing or homelessness or transportation or the continued efforts we're taking around COVID. And Mr. Mayor, we thank you. Our entire region benefits when our city and our county work together. To Council President Dr. Jennifer Campbell, thank you for your leadership in COVID. It is very nice to have a doctor as the leader of our city council. And Councilmember Kate, thank you. It was very early in the early days of the pandemic. Councilmember Kate and I stood together in a bipartisan way to denounce the anti-Asian Pacific Islander insults and rhetoric that were coming, and we are grateful for all of those efforts. The county began the collaboration about 7 months ago around monoclonal antibody medication. The mayor, as soon as he got in, said, what can we do more in the city? And we're grateful for that. I also want to thank the members of the State Emergency Medical Services Authority who are here. Thank you for your partnership and your effort and the tremendous work that's been doing. Monoclonal antibody regional centers have been opened in multiple locations throughout the county. And we've done it with multiple healthcare partners, but we are incredibly thrilled that this site is coming online and coming online now, a time when we are seeing cases increase. Since February 9th, this life-saving treatment has been provided to more than 1,600 individuals in San Diego County, but this location at this time is much needed. And it is a great thing that we are adding. And so we want to thank again everyone for doing it, and we want to reiterate the importance for everyone out there. Don't wait until you get sick. Do everything you can to avoid it, and primary among those is get vaccinated. The vaccine is free, it is safe, it is effective, and we continue to urge that that is the single most important thing folks can do to protect themselves from COVID-19. With that, I'd like to introduce Dr. Wilma Wooten, our public health officer, to explain why early treatment with monoclonal antibodies is so important for our fight against COVID-19. And it is not an alternate to the vaccine, it is an augmentation and enhancement for individuals who may contract it. Dr. Wooten?
Thank you for that introduction, Chair Fletcher. I want to join you in thanking Mayor Gloria and the City of San Diego for providing and supporting this great monoclonal antibody regional center, or MARC, location to yield all of the services that it will provide. By now, you may be wondering what exactly are monoclonal antibodies. First off, everyone should know that monoclonal antibodies are not a replacement for COVID-19 vaccinations, as Chair Fletcher has stated. Vaccinations help your body develop antibodies over time before you get sick. Vaccinations fight the virus that causes COVID-19 infection and are very good to keeping you from getting sick and helping you stay away from serious illness and hospitalizations. Monoclonal antibodies are proteins that have been given the emergency use authorization by the FDA to fight the virus once you are infected. So in short, vaccinations are prevention. The monoclonal antibodies are treatment once you get infected. And the monoclonal antibodies are used to treat persons with mild to moderate COVID-19 infection who are at risk for progression to severe illness. Now, within hours of a treatment, monoclonal antibodies block the viruses that cause COVID-19 from attaching to human cells. And when they do that, it makes it more difficult for the virus to reproduce and cause harm in an individual's body. Monoclonal antibodies have been shown to reduce the risk of COVID-19 related hospital visits and help people feel better faster. Now, if you have symptoms and have been diagnosed with mild or moderate COVID-19 infection, even if you've been vaccinated, we encourage you to call your healthcare provider. If you do not have a healthcare provider and they do not have the treatment available, you or your doctor can call the MARC line at 619-685-2500. That's 619-685-2500 to determine if you are eligible. To be eligible, patients must meet 4 criteria: test positive for COVID-19, have had COVID-19 symptoms for 10 days or less, be at least 12 years of age, and be at high risk for getting very sick from COVID-19. Now, the MARC locations are a new model of collaboration to provide COVID-19 treatment for those with mild to moderate symptoms. This treatment is available to all persons who need it, regardless of their insurance status or their immigration status. We are grateful to the state's Emergency Medical Services Authority, which will staff the marks at this Claremont Friendship Center with experienced physicians and nurses. And as I have said earlier, we are grateful to the City of San Diego for this beautiful building and the support that it will provide. Finally, to everyone in San Diego, please get vaccinated. If you are vaccinated, please encourage your hesitant friends and family and coworkers to join you. And as always advised, please wash your hands, watch your distance, and wear your mask. And now please welcome to the podium Council President, Dr. Jennifer Campbell. Thank you.
Full service.
Thank you. My favorite mayor. You can see why, huh? So thank you, Dr. Wooten, Supervisor, Chair of the Supervisors, Fletcher, and our dear Mayor, Todd Gloria, and to all the others here who have made this happen. Like many people speaking here, I had hoped that another monoclonal treatment center would not be necessary in our county. We all hoped that everyone would get vaccinated and that the pandemic would be in our past. But, as I learned in medical school, if 95% of the population is not immune to the contagious disease, it will rise up and attack those who are not immune to it, and thus it will keep on going and going. Because of the miracle of our body's immune system, vaccination provides immunity. This particular virus in its first form last year was very contagious, but the Delta variant is even more so, such that those not vaccinated are almost 30 times more likely to get Delta COVID than those who are vaccinated. We hope that we would no longer see cases, hospitalizations, and deaths rising all over our country. But this is the reality of our situation, and it is a challenge we face, it is a challenge we must meet, or we will lose hundreds of thousands of more Americans than those poor over 600,000 souls who have already passed away in our country due to this horrible disease. Last year we adapted, we put on masks, we social distanced, washed our hands, stayed indoors, and when the first vaccines were out, December 2020, a majority of us in San Diego County followed the advice of our county health department and got vaccinated, but not enough people did. And so we are still in this pandemic and still facing a medical crisis, and the economics as well as the emotional impact of not having everyone safe from this vicious virus. Hopefully, especially now that we are seeing mandates, many more people will get their shots. However, today we are providing a place for treatment, a treatment method that works for people who have been infected by this virus but are in the early stages of the disease. This monoclonal antibody treatment is a protocol that works and if someone believes that they have the virus, they come to this center, they will get an immediate test to see if they have the virus. And if the answer is yes, they can be given an intravenous infusion of the monoclonal antibodies that will protect them from the worst symptoms of the disease for 90 days. After that, they need to get vaccinated. If they'd gotten vaccinated in the first place, they probably wouldn't even need the monoclonal treatment. However, it is good also for those who break through, who've been vaccinated, that tiny percent of those of us vaccinated who do get the Delta variant. So I'm very grateful that we're opening this monoclonal antibody regional center here in Claremont to address the threat of this COVID-19. Prevention by vaccination is the best way to protect our community in the pandemic. However, if you are infected with COVID-19, even if you are vaccinated, you will now have access to rapid testing and, if needed, this treatment. In the past several months, we've seen many people get treated with monoclonal antibodies and recover. This center, with its capabilities of testing and treatment, is a great example of how leadership of the state, county, and local officials working together to adapt and to keep our residents safe works. We're bringing the best advancements in medicine and technology to our communities to help us survive. And now, I'd like to introduce the council member from this district, District 6, my friend and my colleague, Council Member Chris Cate.
Good morning, everybody, and thank you, Council Presidents, and welcome to District 6. I want to thank Mayor Gloria, Chair Fletcher, Council President Campbell, Dr. Wooten, and all of our amazing health partners for thinking of the Kathy Hopper Friendship Center and the City of San Diego to set up this MARC facility. After being sworn in office in 2014, this was the first place that I visited. My team and I have served lunches to nearly 100 citizens for the holidays here at this center. I've been here for fitness classes with seniors, smoke alarm installation training with the Burn Institute, and sidewalk CPR training for families, just to note a few. This facility always has been a place for healing and for helping residents. And so when I got a call from Penny and the Dream Team, which I've been waiting to say for so long now, about setting up a MARC facility at this center, it was a no-brainer for me. Having the Kathy Hopper Friendship Center now serve temporarily as a monoclonal antibody regional center truly shows how we as a city are able to partner, evolve, and meet the needs of our residents. This is the first and only facility that will offer testing and treatment on site in the city of San Diego and be in this first MARC location. The Kathy Hopper Friendship Center will be a one-stop shop and will help lift the burden our hospitals are facing. So I want to thank you to our partners, thank you to the county for choosing this facility, for choosing District 6 and choosing the City of San Diego to set up this facility. And I'd now like to reintroduce Mayor Gloria.
Thank you, Council Member. Just quick concluding comments. Again, thank you all for being here. I want to say from the start, again, I want to repeat, the collaboration between government partners has been incredible. From our state, county, and city all rowing in the same direction, you'd expect nothing less in the middle of a pandemic. I hope that really communicates how this is an all-hands-on-deck moment, that the stovepipes and the divisions between levels of government don't apply here. We all have to work together to solve the pandemic, and that's precisely what we're doing. So again, deep appreciation to the County Board of Supervisors led by Nathan Fletcher, Dr. Wilma Wooten, who has been a hero for over the last year and a half. Thank you, Dr. Wooten. And to all of our healthcare heroes who know that this works. I want to appreciate the partnership of Councilmember Cate and Council President Campbell. I'll tell you quickly, Council President Campbell gave me a call Saturday afternoon, about a week and a half ago, I would say, said, hey, we need to do this in the city. I called Penny, and by Monday, we had identified this site, and this site now will open in just a few days. So point is that like basically in 2 weeks' time, a need from the state, communicate to the council president, connect it to city staff, here we are. And again, this should be standard operating procedure, but I think it's illustrative of what this means to our community and how important this is. The last thing I would say, and I deeply appreciate every member of the media who's here today, for all of your viewers, for all your listeners, all your readers, all your followers, please make it clear that the MARC is an important addition to our community's COVID-19 response. But monoclonal antibodies are not a replacement for vaccines. Please communicate to every one of your followers, get vaccinated. We're not playing around. This is important. The continued admission of San Diegans to hospitals taking up critical space is a threat to our collective health. And the MARC will help make sure that for those folks who test positive, that they'll be able to have a treatment that may prevent their ultimate hospitalization. And that's a good thing. But it is not a replacement for vaccination. Please, 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 let's continue to make sure that that portion of our community who has yet to get the vaccine, whether they're hesitant, whether they're busy, whether they're flat out opposed, let's make sure that we get vaccinated so we can go back to the life that we had before. Our schools are reopening today. Chairman Fletcher was talking about his kids going to school. My nieces and nephews went to their school today. That's a good thing. That's the progress that the vaccines have provided to us. But I sure as heck would like my nieces and nephews to go to school without wearing masks. I think that'd be good. I think to have a normal educational experience. San Diego, it's in your hands. Get vaccinated, and know that if you, for some reason, do come down with COVID-19 and you meet the eligible criteria of having mild to moderate symptoms, that you can get the monoclonal antibody treatment here at the Claremont Friendship Center. It'll make you much less likely to go to the hospital, much more likely to stay alive. This is a good thing, everybody. This is government collaborating to get big things done, and we will continue to operate this way until we defeat this pandemic. It is the most important thing that any of us are doing right now. We'll be happy to take some questions, but I think we're going to take a photo in front of the sign to mark this historic moment. Happy to answer questions individually. We have healthcare heroes who are here who can talk about this in a much more authoritative way than I can. I just know it's good, and more importantly, I know you should get vaccinated. Thank you all for being here today. I appreciate it.
Can we have Wilma come back up?
Yeah, well, if Dr. Wooten would like.
Dr. Wooten would like.
Hi.
Morning.
Good morning.
Question. So, previous speaker said that if you have the symptoms
Mm-hmm.
and you feel like you're getting sick, you can walk in here, get tested, and get the treatment at the same time. Is that true? I mean, because it seems like it's going to be overwhelming.
Well, we have 4 other centers that have already been stood up, and that can be part of the process. So this is a well-oiled wheel. They know what they're doing, and they've been doing this, again, through partnership with the state, as well as our local county staff. So I think we can handle it.
And the supply, how about the supply?
We have no issues at this point in time with the monoclonal antibody supply. Thank you.
You mentioned that this was created within a matter of 2 weeks. Was that a direct response to the spike in cases that we've seen?
Yes. Council President, this was all you.
Absolutely. We want, the wheels of government work slowly. And I'm a physician, and I'm not used to things working slowly. When somebody's sick, right, all the doctors are laughing at me. When somebody's sick, we order things. And if we have to order them stat, we order them stat. Dr. Tudor called and said, hey, we need this. The state wants to do it. Let's do it. And the mayor immediately jumped into action. So this is how things should work. Everybody working together. We're one city, one team, one county, one state. We are united. We are united for progress, for prosperity, for health. And the health is number one. I know a lot of people don't put health first, but we doctors do. And that's what we worry about, is your health. We understand the science. We understand how the body works. Listen to us. We know what we're talking about. I am very old, and I could tell you, when I was a kid, we used to have things like measles, polio, mumps. You don't see that anymore, do you? Why? Because of vaccines. And we used to have to put red signs on the door of people where measles or mumps or polio was. We put red signs that said, quarantine, do not enter and do not leave. That was terrible. And you want us to have to do that again? Let's not go there. This is the modern world. This is the century that's way ahead of the century I trained in medicine. Vaccines have been available since the 1760s for smallpox. That was the first one. And we have got to learn our lessons from our history and from our science and our technology. Do what's right. It is important that you be a responsible member of our society and protect others. So get your vaccines. Thank you.
Speaking of being responsible, there are people who are going to look at this and say, well, if people don't want to get vaccinated, why are we extending our necks to try to help save their lives? What is the response to people who think that this?
You know what? We love to save lives. That's what we're here for. We're here to prevent illness, and if it comes, to save you. That's our mission in life. That's our calling as physicians and scientists. And I'll tell you what, when I was a resident, I was on call one night and got a call from the ICU, and they said, you got to come up here and help this guy. He's in terrible heart failure. And I said, I'll be right up. They said, before you come, we got to tell you he has a tattoo on his arm. So I'm so old, I can tell you there were a lot of people who had tattoos because they were in Auschwitz or they were in concentration camps. And they escaped with their lives and escaped the Nazis and came to America. So I said, oh, is it a Holocaust survivor? And they said, no, it's 2 lightning bolts. So I don't know if you guys know what that means. That means Hitler's SS. This guy was an officer in Hitler's SS. I'm Jewish. I looked up at God and I said, "You're testing me, aren't you?" I went up there and I saved his life because that's my job, that's my profession, and that's my calling. So listen to me, folks. We do not want you to die. We want you to get your vaccine, live, and have a wonderful life. So please, listen and do what you need to do. Be responsible. Thank you.